Okay, so we're live now, right? Welcome everybody. This is our second Facebook Live event from RGV Cosmetic Surgery and Vein Care here in Edinburgh, Texas. I am Dr. Filiberto Rodriguez, the cosmetic surgeon, the vein specialist, and I can do med spa, but I prefer to have a full-time dedicated nurse injector who works closely with me to provide the med spa services in our practice. So the last time we did this, we're always prepared with a lot of some prefabricated questions, but a lot of people said they got upset because we didn't answer their questions. So the sooner you can get your questions in, we have people here who are going to read the questions to us so we can make sure we get as many of your questions answered. A couple things I want to talk about before Laura and I start talking is one of the big changes we've had to make due to the whole COVID situation is we've had to temporarily shut down our Brownsville office. So for any of you from the lower valley, Cameron County, please make the drive to come see us to get your veins taken care of. It's not that bad of a drive. And the problem with Cameron County, the COVID count was just getting too high. And our office in Brownsville is a lot smaller and not as COVID friendly as our nice big Edinburgh office, where social distancing happens not even by accident. You're just always social distancing in this building. You have to make an effort to get close. So it's a lot safer environment, and we provide all of the treatments here on site. So without further ado, before you guys start asking us questions, let me tell you a little bit about Laura. Laura, you've been here with us full time now, coming up on what, 6 months? 6 months. That's crazy, just like that.
Yes.
Tell me, I've been extremely happy with your work since you've gotten here day one. But why don't you tell me and share with us, what do you see as the differences between being here with us and with the team that we have versus kind of maybe some of the other places you may have worked in the past?
I think one of the main differences is that I do injecting full time.
Here?
Here. And so
But that's not the case everywhere?
That's not the case everywhere. Some people don't maybe have enough clientele or patients coming in to be injecting every day, but I remember when we first talked, you said, I want you in that room with a syringe in your hand all the time. And that's what's going on. So it's very interesting working here because it has given me a chance to be more creative with the work that I do. I have a full range of products, which is very important in my line of work because not every patient is the same. Their facial structure is not the same, their expectations are not the same, so it's nice to have a wide variety and plenty of product. So we're never short here of product.
We use different brands.
We use totally different brands, so I'm not really biased to one or the other. It's what's best for the patient.
I think that's an important thing, having the right tools to pick from, to tell the patient, they might come thinking they need a brand name like Juvederm, and there's nothing wrong with Juvederm, it's a great product, but they may be better off with a different product called Radias, which is from a different company. And because we're so busy with both, we get the discounted prices from both. So it's not like the consumer suffers. In fact, they actually win having someone like with your knowledge and your skill to be able to really assess them and say, you know what, you'll be better off with this.
Right.
I think that's important.
It is, because I get a lot of patients that come in and really don't know what they've done in the past or a product that they've had put in their face in the past. So I'm able to have that time to talk with them one-on-one and explain the procedure, explain the product, and so it makes for a better outcome and they're more comfortable.
Cool. Yep. Now you're also starting to get more involved with our whole lasers as well, right? Because we have a lot of lasers. People don't realize, we have the state-of-the-art tattoo removal laser, state-of-the-art laser hair removal, state-of-the-art photofacial laser, state-of-the-art, the Morpheus facial resurfacing.
I love that.
We have a lot of lasers and chemical peels to offer the patients that they don't even realize.
And Thermiva.
And the Thermiva, that's true. And tell us a little bit about what Thermiva is.
Thermiva is radio frequency, and it's used for vaginal wellness for the woman, and it helps to tighten, increase lubrication, sensitivity, all with no downtime.
Zero downtime.
Zero downtime. That's my favorite part. It's very comfortable, and a patient can come in, get the treatment, and go back to her daily activity like gym, sauna,
other stuff.
Other stuff.
Yeah. Honestly, that's what my patients in the past have told me, like 0 downtime.
0 downtime.
And some have even said it even helps them with some incontinence. That's not really what it's FDA approved for marketing, but patients say it's even helped me with my incontinence, which is great. So with the Thermiva, we normally recommend 3 sessions spaced out, but they can see benefits starting as soon as their first benefit.
As soon as their first session's over, like even as I'm doing the treatment, I can tell as the vagina is
the tissues are tightening
up.
That's really rewarding.
It is. And then I can also add the O shot because I'm O shot certified, P shot certified. And
what is the O shot?
The O shot is where we take plasma from the patient and inject it into...
Would we spin it down for platelets?
Spin it down for platelets in the centrifuge right in front of them.
And then you identify that sensitive area, the famous G spot.
The G spot.
And then you augment it with their own platelet-rich plasma.
Exactly. It's very little downtime as well.
Yeah, that's true. You can do it at the same time as you do the Thermiva.
Yep.
Yeah, so there are a lot of these kind of treatments that we offer here that people just don't even realize, I guess, because it's not in the name. Because the name, people stop reading RGV Cosmetic Surgery.
Right.
And they stop reading like, oh yeah, and vein care, and med spa, and it's not just and every one of those 3 facets of the practice is full time.
Yes.
Hardcore. Like so busy with the veins that we have to have our own ultrasound technician on site to do the diagnoses and to do the procedures. So busy with cosmetic surgery that we have to have our own 2 Rs and our own full-time anesthesia provider who they met last time. And so busy in the med spa that we have our own full-time injector with the lasers and the products.
Right.
Yeah, so there's a whole list behind us here that goes over everything. It's a lot. It is a lot. And sometimes people don't realize how much we do.
Yeah, it's exciting. I thought that we were going to slow down a little bit after we reopened, but of course with all the precautions we're taking, we still have a full schedule and patients wanting to come in.
And we have streamlined things, you know, for the COVID. Like right now, Laura's wearing a regular surgical mask, but when she's injecting, she's wearing the special N95 mask and eye protection. I've installed special air filters into the med spa injection rooms, into my ORs, in the waiting room, in the nurse's station. That extra filtration for the air, and it's been proven, and that's actually hospital-grade air filters that's been proven to significantly decrease the COVID and any other viral bacterial contaminants that may be in the air. So that's an extra thing we've done.
Yeah, that's probably the second best thing that I've been hearing from patients when they are done with their treatment with me. They'll say like, oh, I was so nervous to come in, but actually I feel super safe. I'm glad that you guys checked me. I'm glad that y'all are taking precautions and everything seems real clean, and they feel comfortable, which makes me feel good because it's important for me to come to work and feel safe. And it's super important for the patient to feel that as well.
Those air filters are nice, right?
Yes.
Yeah, they're the molecule. I have no
I
proprietary.
tried to buy one for my house, but
they're a little expensive, right? Yeah, but they are powerful. They are very powerful. They have good payment plans, though. Just check it. We also have a full-time cleaning service here. He actually came to us from one of the hospitals I used to work at when he heard I was building this facility. He wanted a different job and he wanted to come work with me full-time. He does a phenomenal job keeping this facility clean and spotless in the ORs as well as the nurse's station and everywhere here in the waiting area. We've had to take out a lot of our chairs from the waiting area. We don't really have a lot of people waiting in our waiting area. We have them waiting in the cars like most places do, but we try to make it as comfortable a process as possible for patients.
So we have a question and they're asking, are we still doing virtual consultations?
We are still doing virtual consultations, and mainly for me, not so much for Laura. It's not useful for Laura. And for the veins, I cannot do a virtual consultation with the veins because you need an ultrasound to really outline what you need for vein care. But for me, cosmetic surgery consult, absolutely. The only challenge is if it's a redo breast augmentation, those are really complicated consults. Those are not good for virtual consults. Even simple breast augmentation is difficult to do virtually because we can't measure and help you pick out the right implant size and style. So breast augmentations and breast procedures are a little harder to do virtual, but tummy tucks, lipo, fat transfer, all of that we can do virtually. And then, you know, once you get to meet me virtually, and we actually find that the virtual consult experience has become it's much more intimate. It's really kind of special because, you know, we're doing this consult and the patient's in their home. Right. So it's very intimate to be talking with someone that, you know, what they're concerned about and what they want to have done, and they're there in their house. It's different here in the clinic, you know, when they're in their robe and, you know, I come in and I have to examine you now. But virtual consults are very effective. The patients have liked them. We've had good experience with them, but certainly we've learned that, like I said earlier, the breasts is more difficult to do virtually, but almost everything else is good for virtual. And we do that, and just when you call to the front desk, just let them know that you're interested in a virtual consult. And I think my staff is actually still offering the virtual consults at a reduced rate, you know, just for convenience of the patients, but they are effective. So the question was that the primary 1-hour breast augmentation surgery is discounted for this summer. What does that mean? Well, it means if you look at the before and after picture galleries, there's a section that just says breast augmentation. And if you look at the befores, they tend to be skinny, flat-chested women or women with small natural breasts. And so then we do an implant. That's a simple, what I call a simple 1-hour breast augmentation to place an appropriately sized implant to give the patient the look they want. That is night and day from, if I may, Laura's had surgery in the past, yes, and she's not happy with her outcomes. And so to do her surgery, we talked about having to use a mesh, we talked about redo lift, new implants. That turned into like almost a 4.5-hour surgery or something.
Revising the scars.
It gets complicated, revising the scars, replacing the implants. So a revision breast augmentation surgery is very different. Or even just a breast aug with a lift. If I have a lot of the women who come to see us, they've already had their babies, and they don't have that perky breast they might have had in their 20s, and they're more saggy. And if they can hide maybe 3 fingers under their breast, well, then you need a lift. You can't just throw an implant in there and pretend that it's going to look good. So when we talk about the 1-hour primary breast aug, which was the question, we're talking honestly, there tends to be slender women with small natural breasts who want to augment and hit more fullness up in their upper chest area. We tend to do those either through the inframammary approach. I do small scars, maybe 3.5 centimeters, or if the areolas are big enough, I can hide the scar in the areola. And my staff have seen them and they're like, wow, I can't even see the scar. So they're really nice. They're really nice surgeries. So the question was, what is Vaser liposuction, and is it the same as liposuction? It is much better than liposuction. It is surgery. So Vaser liposuction is real liposuction surgery. It's just that before we get in with the cannula to suck out the fat with the suction, we pre-deliver high-frequency ultrasound energy, and it starts to break up the fat. And I really started getting into Vaser liposuction years ago because I do so much redo lipo. And redo lipo is really hard because of all the scar tissue from the prior lipo. So the Vaser really helped break up the tissue so I can get a better result. And I found, why am I doing any liposuction without Vaser? Vaser makes all of my liposuctions so much better. So I personally don't do liposuction without Vaser. The Vaser has another benefit. It's not marketed as a skin tightening technology, but it does give me a little bit more skin tightening when I do lipo with Vaser than lipo without. But for real skin tightening, that's the newer technology called Body Tight. And so if there's an area, so a lot of women come and they don't like their arms, for example, and I know that Vaser liposuction is not going to get them where they want to be, but they don't want a scar, then we'll add on Body Tight. So it's Body Tight with Vaser liposuction. So think of Vaser liposuction as Vaser with liposuction, and it creates a really smooth contour. You know, unfortunately down here in the valley, we see a lot of bad liposuction where you can feel where they had the lipo, you can see the ripples and the contour defects, and that's really hard to fix. You know, bad lipo like that is really, really hard to fix. So just, people should never think that, oh, it's just liposuction. I mean, of all the surgeries we do, it's the most blind procedure. I mean, you can literally kill someone with liposuction. So that's a misconception I think people have. They always say, oh, it's just lipo. There's no such thing. Actually, take it seriously, because it's actually easier for me to fix a really bad breast job than it is to fix bad lipo. Because I can work with more products to fix the breast than I can with lipo. Even with my Vaser, even with my body type, even with all my other technologies, it's just really hard to fix. Well, that depends on who does your surgery. So the question is on average, what is the recovery for cosmetic surgery? Number one answer to that question, it depends on who your surgeon is. A lot of you may have seen Mary Jane. She was very vocal when she had her tummy tuck, and she actually had about a 9-hour surgery with me. Vaser liposuction with body tight to her arms, Vaser liposuction with body tight to her back, her flanks, her tummy tuck. And she was back to work 4 days after her surgery, and she was standing upright. Now granted, she had help here with us in the office. She didn't lift anything heavy, and wasn't moving around super fast, but most of my tummy tuck patients, for example, they can go back to work after 2 weeks, no problem. Unless you work in the hospital as a nurse or you do heavy lifting as part of your job, then you need a full 6 weeks out, not because you're in pain, but because you can't do any heavy lifting for 6 weeks after a tummy tuck. So same thing, recovery for me with one of my breast aug patients, let's go back to the 1-hour breast augmentation procedure. Those patients are actually put on what we call a rapid recovery protocol, where we want them to go out for dinner that same night. And if they work at a regular banking job or secretary job, they can have the surgery done on a Friday and they're back to work on Monday. Yes, they'll have some muscle spasm, they'll be a little tight, but they're not miserable. I think the main procedure that I do that has the most downtime, to be honest, is actually lipo. It's the swelling, and you have to wear the garment, and again, they're not in pain, they just feel swollen. They feel like the Stay Puft Marshmallow Man on Ghostbusters for like the first 2-3 weeks until the swelling goes down. And so that's just part of lipo. And same thing with fat transfer. Fat transfer to the butt, well then it's common sense. You're not going to be sitting or laying on your butt too much for the first 2-3 weeks so you don't squish the fat. And that's part of the recovery. So I think the main problem down here is that there's a lot of fear about cosmetic surgery, because a lot of people, either they've gone to Mexico or they've gone to Houston or they've gone to Dallas and they come back and they can't move for like 3 months and they feel terrible. And that's just not the way our patients recover after surgery with me. And I've said this before, the analogy to this is my dad started heart surgery here in the Rio Grande Valley in 1983. He has become famous with the Jehovah's Witnesses down here because the Jehovah's Witnesses refuse blood transfusion. Right. And my father is one of the few surgeons who does bloodless cardiac surgery. So again, how does he do that compared to other heart surgeons? Well, it's obviously the way he operates. So his patients recover faster than other heart surgeons' patients. So for those of us just joining us, I'm Dr. Filiberto Rodriguez with RGV Cosmetic Surgery and Vein Care. I'm joined by my lovely nurse injector, Flora.
Hello.
And we are here doing a Facebook Live event trying to answer your questions. And we're just waiting for some live questions to come in. What happens is they tend to come in towards the very end of the event. But we have some questions that my staff has gotten routinely that we're trying to answer as we go along.
So next question, who would you recommend to get labiaplasty?
Me? I mean, I'm sorry. The question was who would I recommend to get a labiaplasty? The answer is me. I have worked in the past with an OBGYN who I had to teach how to do labiaplasty. So even though it seems that something that they train for in OBGYN, it isn't. They don't learn how to do that. And in fact, the American College of Obstetrics and Gynecology actually is conflicted with the whole procedure of a labiaplasty. They don't feel that it's medically indicated. But the reality is it is a cosmetic issue. And I learned how to do labiaplasty surgery where I trained in my cosmetic surgery fellowship in Scottsdale, Arizona, and my mentor, and we were doing 2 to 3 labiaplasties a week. And we have a refined technique on how to do it so that you can't see the scars, you respect the clitoral hood so that you don't lose sensation, you don't cause pain for the patient. Because that's a problem. You get the labiaplasty done wrong and you can cause chronic pain in that area if it's not done right.
And who would do that? What type of women?
Well, women who come to see me for labiaplasty, they tend to be younger, they tend to be slender. they're very self-conscious that the labia minora protrudes out more than the labia majora, and it gets in the way of their exercise. There's a lot of chafing. It gets in the way of their intimacy, to where they're having to manually move things out of the way to proceed with intimacy. And they just don't like how it looks. And there's just been a lot of changes in our society. You know, now that basically everyone kind of waxes and gets lasered, then that part of the body is much more visible. And sadly, there's the proliferation of adult TV, and a lot of young ladies are watching that, and they get a perception of what they're supposed to look like. And so we make sure when we talk to them that they understand what they're having done. There is a recovery with labiaplasty. So you need 6 to 8 weeks where you're just really taking care of yourself down there. No intimacy. No, you have to use pads instead of tampons, little things like that. You have to be gentle when you wipe, because those suture lines are very delicate. And the other surgery that we do that has a very delicate downtime recovery are the gluteal implants. That area, people like to hide the incision right between, and the problem with that area, it likes to move and it breaks and likes to open up. So the gluteal implants are the ones that have the longest conversation with my patients, that you need to be prepared to self-quarantine for 4 weeks and just be at your home, either laying on your tummy or standing on your feet. But you're not going to be sitting or laying on your butt for the first 4 or 6 weeks to make sure that that wound heals up real nice and make it nice and invisible. So.
Is it normal to have a headache after Botox injections?
Repeat the question.
Is it normal to have a headache after Botox injections? It's not 100% normal, but it can be a side effect right after the injection. So some patients will feel a little bit of heaviness, maybe a little bit of soreness, and they might get a slight headache, but it's actually used to help headaches and migraines. So
yeah, there's actually an FDA approval of the same Botox neurotoxin to actually treat migraine headaches. So I guess in your experience, how many of your Botox patients actually come back complaining that they have a headache from their Botox, in your experience?
very few.
Yeah.
I mean,
And I think that's all
pretty
you
much none. Actually, I'll see patients that come in and say, I went somewhere and now I have this headache. Sometimes what happens is if the area is not treated the way that it should, you'll get pulls in different directions. That's almost like you flexing your bicep all day. It's going to hurt. So if the muscles aren't treated correctly in the face, they might have some pull and tension, which causes the headache. So it is something that can happen, but it shouldn't happen if it's treated correctly.
You don't have to be embarrassed to say that it can be provider dependent.
It can be.
But in your hands, patients tend to not get headaches.
Exactly.
Yeah, that's the key thing. So can it happen? Yeah. I think what happens, sometimes the injectors also are just heavy-handed, and they're just hurting the patients with the needle. So the poor patient has a headache afterwards. I've heard of that too, but that hasn't been my experience, and I know it hasn't been yours.
No.
Let's put it this way. If I was going to get a lot of complaints about something, I'd hear about it. And I haven't heard anyone complain about headaches with you. All right? So I hope that answers your question. So that's the question is, how many hours is surgery for a mommy makeover? And the answer to that question is it depends. It depends on how big the mommy is, how much lipo the mommy needs, how long of a tummy tuck the mommy needs. Does the mommy need a simple breast augmentation like we discussed earlier, a 1 hour breast augmentation versus a 3.5 hour breast augmentation with lift? So standard tummy tuck, 3.5 hours. Most women need additional liposuction to their flanks and back to give them that nice contour. That's like another 2 hours. That's already 5.5. If you need a breast aug with a breast lift, now you're already at about 9 hours. And then they always want to add on fat transfer or something else. And so our cutoff is 9.5 hours of surgery. And I've been doing that safely for the past 10 years. And I've even published papers about how safe it is to do that, even though I know a lot of people don't do that. So if a woman comes to me and they want this and they want that and this and this, we'll say, okay, let's break it up. So a mommy makeover, just for those of you who may be wondering, is basically, I want to fix my tummy area and I want to fix my breasts. That's a mommy makeover. But it gets more complicated than that. Because do you just need Vaser liposuction with body tight to your stomach? Because maybe you're one of these skinny minis who didn't get a stretch mark and doesn't have stretched out muscles. And you don't really need a big breast lift. And so your mommy makeover could easily be 2.5 hours plus 1.5, so you can boom, be out of here by 5 hours and you're home the same day. Whereas the majority of our mommy makeovers tend to be more like 12-hour, 15-hour surgeries that we have to break up. And so I'll say, okay, let's start with the tummy and the lipo and the fat transfer. That's already a long surgery and you'll spend the night. Then once you've had your tummy, most women are a lot more comfortable because now their stomachs are flat. Then they can try on the implants and feel more comfortable and say, yeah, you know what, I think I want this implant, whereas before they were more shy and they didn't know what they wanted. So then they can come back and we do the breast dog, breast lift, and whatever other might be needed to finish off their mommy makeover. And I can do the breast dog, breast lift as soon as 4 weeks after the tummy tuck. And you can still, quote, have your mommy makeover because you're wearing the compression garment for 6 weeks anyway. So, but I would say the shortest time that you can do a mommy makeover, if it's just a tummy tuck, 3.5 hours with a little bit of lipo, and just a simple breast dog with no lift, that's a 4.5 hour surgery. I can count on one hand maybe 2 or 3 patients that I've done that surgery on in the past 10 years. The majority of them are basically between 9 to 14 hours worth of surgery that usually need to be broken up. So,
Which is a real makeover.
Which is a real makeover, exactly.
Yeah.
And it really, really changes their body. And they really go back to like, oh wow, this is what I remember being like. And everyone's really, I don't know if anyone here is familiar with Dr. Ray, Dr. 90210. He used to be famous on TV from LA. And I've met the guy a couple times when I trained at UCLA. He's so funny. He would be like, your moms make the biggest sacrifice. You sacrifice your own body to bring life into the world. You know, he's over the top. But the bottom line of the thing is, what I do tell my patients is, because I have a lot of women who go to the gym, and they go to the gym, and they go to the gym, and they just cannot lose that extra skin around their tummy, and they cannot perk up their breasts. And basically what I tell them is like, look, give your gym 6 weeks break, and what I can do for your body, and that downtime of 6 weeks from the gym, you will never get to make those changes in the gym.
First one, what age do you recommend for people to start getting Botox?
Age, I usually say there's 2 types of patients that come and see me for Botox. It's either for treatment or for preventative. So preventative is going to be what people throw out there like sprinkle Botox, baby Botox. That's not for everybody. That is literally preventative, meaning less product, less medication to treat the area. We just want to weaken the muscle, not really paralyze it. And for somebody that's coming in for a treatment, if you basically are looking in the mirror and you're not making an expression and you have fine lines visible, that's a treatment. That's about the time you should. There's a lot of things that go into that, like skin color, your muscle strength.
Yeah.
Do you drink water? Do you rest well? There's a lot of things that go into that.
Do you have a lot of sun damage?
Sun damage, what do you do? Are you stressed all day? I mean, but when the patient comes in for a consult, we go over that and see what their expectations are. I even have some more mature patients that come in that need a treatment, but they literally will tell me like, I want to look my age, just not so frozen or not so we talk about that. As long as we're on the same page, that's usually the best way to get it.
Again, I think there's a fear that, oh my God, if I get Botox, I'm going to look like a freak. And I could always tell my patients is, Botox is just a product. It's just a drug. The result comes from who's injecting you. So it's just like me with my surgery. People say, oh my God, your liposuction always looks so good. Oh my God, your breast always looks so good. Okay, well that's because that's me. That's not just any random person doing the surgery. So same thing with Botox. And I think the best answer I give patients to that question, like how old should I start getting Botox? Look, when you're little, most people who get Botox tend to be female, even though Botox is definitely on the rise. But we use the woman analogy in that when they're young, they make that little bunny nose face and they think it's cute. Well, once you start getting into your late 20s and that bunny nose wrinkles are still there, even when you're not making the face, that's when it's time to start getting Botox because those wrinkles are just going to get worse.
Yeah.
That's basically the best answer to that one, I think.
Next one, I think this is for both of y'all. Can a
So the short answer to that question is, can fat transfer be done to the lips? Yes,
Yes.
it can. There's a lot of things that we can do. Fat transfer to the lips tends to really not work. The problem with fat transfer, now there's some new fat transfer technologies coming out called nano-fat transfers, and that tries to make the fat molecules even a little smaller. But the problem I have with fat transfer to the lips is the lips are moving. So fat transfer to the butt, I mean, the butt's just there. So you just have the fat formulate where it needs to be. But in your lips, the lips are moving. And so when the lips move, they can actually cause the fat to clump up. And it can actually look really ugly. And the fat transfer results to the lip are not permanent. There's a lot of lies on the internet that fat transfer to your lips is permanent. No. And even fillers last less in the lips than they do on the cheeks, because the cheeks are stationary. The lips are moving. So you need to come and get your Juvederm to your lips about every 3 to 4 months, sometimes 6.
Right.
Right? But I personally don't believe in fat transfer to the lips for that reason. And there's really nothing worse than having a woman who's had fat transfer to her lips come to me, because I have had this. I've had a woman come to me, all these granules and lumpy bumps on their lips, and they're like, well, what can you do? Nothing. I can give you a big ugly scar on the inside of your lips. I'll send you to my friend who does facial plastic surgery, and he'll cut you on the inside of your lip and try to carve out those fat granules. But other than that, there's nothing to do. Whereas with Juvederm, if you come back and say, I don't like how my lips look, one, you can say, well, do nothing, it'll go away in 6 months. Or we can inject you with this chemical that can erase the Juvederm. So that's why we really just don't do fat transfer to the lips for that reason.
Right.
Next question. What can be done for saggy necks?
Saggy neck?
Saggy neck.
Like saggy, the question is, what can be done for a saggy neck? There's really 2 options. And you have to make a decision. What's going to bother you more? If you still feel you have a little bit of a saggy neck, or I really don't want to have any scars on my face. Because I can do face tight, which is Vaser liposuction with face tight, which is a form of skin tightening to the face and neck, combined with Morpheus, which is radiofrequency microneedling, which further helps tighten the skin. And that gives a very good result, but that's never going to replace a facelift. So if someone has really bad heaviness, then I'll refer them to my ENT facial plastic colleague who does nothing but face and neck lifts, and that's basically your 2 options for sagging necks. Once upon a time, there was the string lifts that they were trying to do, and I tried them years ago, and I was never happy with the results, so I've stopped doing the silhouette strings for the necks. It didn't work. But now with the face tight, much better than the strings. Face tight didn't exist back in the day when they were trying to do the strings. So technology continues to evolve. Right now the best is face tight with Vaser liposuction. Some people are advertising J-plasma, which is another form of technology for skin tightening. Between face tight and J-plasma, the results really aren't that different. I personally just like the face tight technology better.
Next question. Are cheek fillers and nose fillers different?
It's a good question for you, Laura. Are cheek fillers and nose fillers different?
Well, they both fill. So they're both fillers. Are they different?
They're the same.
They're the same, but I use different product for the nose than I would for the cheeks sometimes. Sometimes I'll use what I use on the nose for the cheeks and vice versa. It's a little complicated in that sense,
and this kind of
it
comes to
does
the
the same
concept
thing.
of that dermal fillers are not one size fit all.
Right.
And Laura and I have all of them.
Yes.
So we can basically choose, like, well, if we're going to make pumpkin pie, it's different than apple pie.
Right.
So we're going to pick the different ingredients to make what we need. So same thing, if you got a certain problem with your nose, Laura will pick the appropriate filler for that versus the cheek.
And sometimes I combine both or several fillers because I specialize like in facial slimming and contouring. So sometimes you need several different fillers in several areas. I'm a more natural injector, so I like to use the right product in the right spot so that I don't have to overfill and make you feel uncomfortable. You'll just look very natural.
I think that's an important point. That I like how you said that you're a natural filler, because you do. When we talked about this when we first met before you came on board, you have a very pretty face. You don't look like some of these over-injected clowns. And the problem is if you go to a med spa and if you see the woman who's about to inject you and you look at her face and you're like, oh my God, I don't want to look like that clown. Well, be careful, because that woman clearly thinks that's what good looks like. because she did that to her face. She let someone do that to her lips and her cheeks, and that's what a lot of people get scared of, and that's what we try to talk about. Just look at who's doing your injections, and you'll get a pretty good idea of what you're going to look like. You know, because when Laura wants her nose and her cheeks done, you know, she'll come to me, and I'll just do her fillers, but I'm going to make her look nice and natural. So that's an important concept with fillers. I think they get a bad rap. Botox gets a bad rap, lips get a bad rap, all fillers get a bad rap, because the people who are injecting most of them don't know what they're doing. Most of them just went to one weekend course and then they start injecting. And most of them are working with a doctor who also doesn't know what they're doing, and basically said, well, look, I'm just busy taking care of patients. You went to the weekend course, you do those injections. That's what happens down here a lot.
Yeah,
that's what happens down here a lot. And we see it. We see a lot of these bad injections. And sometimes we can do something about it, and sometimes you just got to really wait, because some of these fillers last years now.
Yeah.
Some of the fillers last years now.
So one question. This girl said that she's a side sleeper. What can we do for chest wrinkles?
The cleavage. Actually, there's a lot that you can do for that.
Yes.
Talk about it.
I can do hyperdiluted radius. So it's a special technique using one of our calcium fillers to act as an anti-aging product that I lay underneath the skin to produce new skin and tighten.
It triggers collagen synthesis. It's a new use of a product.
Yeah.
It's a really exciting treatment. It's a hyperdilute radius. Laura's actually great at it. I mean, she's actually better at it than I am. And what I would do for the décolletage area is start you off with a Morpheus treatment,
Yes.
which is radio frequency microneedling, usually done under IV sedation, but we would go ahead and do your whole face, neck, and décolletage area. And you can space out the Morpheus every 6 weeks, and you get 3 treatments of the Morpheus, and that'll really trigger that collagen and skin tightening. And then after the Morpheus, you can go to the Radius. Or if you want to start with the Radius, you'll probably still end up needing the Morpheus anyway, but it depends on how bad it is. Some women obviously have it really bad. Like they always show that scene on There's Something About Mary, where that woman who laid out all the time had it really bad. But everyone depends. But yes, it is a problem, especially on women who have larger breasts and who are side sleepers.
Don't sleep on your side.
But that's how she sleeps. So we're getting into the kind of bottom third of the hour, and we're going to reintroduce ourselves. I'm Dr. Filiberto Rodriguez. This is Nurse Laura Navarro, our nurse injector, here at RGV Cosmetic Surgery and Vein Care, and we're taking your questions live on Facebook. So I don't know what that means. What treatments can we record? We can record any treatment if the patient gives us consent.
Right.
So we always have to get permission from the patient. So there's actually a specific photographic release form that they sign that allows us to either take pictures or to record their procedures. I'm assuming that's what the question is. So the answer to that question is anything can be recorded if you just give us permission.
Mm-hmm.
Well,
What treatments do you recommend for sun-damaged skin?
the photofacial and melanage.
Yes.
I mean, that's what the lasers are for.
Yep.
That's what the lasers are for. So we would, what do you think? Start with the melanage or start with the lasers first, then clean up with the melanage?
Yeah, I would probably do the lasers first.
Yeah. The tattoo removal actually is fantastic for age
Photofacial.
spots, stubborn age spots. Usually start off with an IPL, photofacial. That really gets rid of a lot of the age spots. And then to fine tune it, once that's all done and you've healed, we will do the chemical
Melanage,
peels.
chemical peel.
A quick question, now that we just talked about sedative, do you have specials for the summer?
Oh, yes,
Yeah.
we do.
We do. You guys, my
post
team comes up with monthly specials on a regular basis, and those can easily be found where on our Facebook page.
Facebook page, but I think we talked about if they purchased a filler, they'd get an area of Botox for free.
And a lot of the specials that are done in the med spa are sponsored by the companies that we buy from. So they will actually help. They will say, "Hey, let's do this promotion. Sell this fillers, and we'll give you this much Botox for free." Stuff like that, and that changes month to month.
Yes.
And then can Vaser lipo be done to a double chin?
100%. The question was, can Vaser liposuction be done to a double chin? Answer is 100%. And then the only question would be, do we need to add on face tight, which is that bipolar radiofrequency skin tightening to really get that double chin up. Now, there's a difference between a male and a female. We don't like to do face tight on men because right now facial hair is back in style, and face tight can get so hot it can kill the hair follicles. So most men choose not to do face tight, but if it's a woman who has the double chin, it'd be nice to add on the face tight, especially because the female skin tends to be more lax. Men's skin responds better to the Vaser liposuction by itself.
Next question. How long has the nurse been doing fillers so far?
For a little over 5 years. But it's great because I really love what I do. It's not just about technique. It's like Doctor was saying, you can go to a course and they're going to teach you the basics. But I feel, I can say this now, that you really need an eye. You really need to be patient and understand what that person is wanting to accomplish and achieve when they walk out of here. And so it's not just about A plus B equals C. It's kind of like you have to constantly be learning, improving your technique. I have a great background. I'm always doing online courses, especially with this COVID going on, and it is always nice because Doctor's always available. He's really, even more recently, taught me some very unique deep injection techniques that I'd never learned before. So this is a dream come true to have, you know, a doctor like him be right there in my corner whenever I need to ask him for something or advice, and he's always available. So
Thank you.
yes, thank you.
Well, I mean, I'll just say this. I'm not going to say this is because of me, per se, but 2 times in the past 10 years, I have had nurse injectors taken from me by company, by corporate, because they come and they see how well they inject, that they say, we want to bring you on corporate so you can be one of our trainers. So I lost 1 nurse injector early on from Brownsville, and then Allergan took her from me, and then recently I lost another nurse injector for the same thing. So it's bad for me because then I have to get another nurse injector, but I would never bring on a nurse injector who really had 0 experience. Laura came to me very highly recommended. In fact, Mary Jane, who you guys might remember from the prior Facebook Live event, she's our CRNA anesthesiologist. She used to get all of her fillers with Laura before she met me, and obviously then I started doing her fillers until Laura came back on board with me, so now Laura is doing all of her fillers. So yeah, I mean, it's been a great addition to the team, no question.
So next question, what vein treatments do we have for varicose veins?
We offer, the question was, what vein treatments do we offer for varicose veins? We have one of the most comprehensive varicose vein clinics in the United States. Varicose vein disease is fairly complicated. It can be as superficial as a young lady who doesn't like her spider veins, or as severe as a man with bulging veins all over his legs that keep popping and bleeding all over the place, and everything in between. And it can get as bad as the skin breaks down and they have chronic vein ulcers, which is one of the main reasons that insurance will pay for vein treatments if certain criteria are met. So when a patient comes in to see us for vein concerns, they will start off with an ultrasound examination, because without the ultrasound examination, we cannot assess the severity of their vein disease. Based on that ultrasound result, we can then come up with a treatment plan of what veins need to be treated and what additional procedures need to be done to treat the more visible varicose veins that the patients are complaining about, whereas we're treating the deeper system first to make sure. So the way we try to explain the veins is, think of them as an upside down tree. The patients will come complaining about these little leaves and twigs on the side, but if the trunk is all diseased and poisoned with termites, there's no point in treating the little leaves. We got to make sure we heal the trunk and then go out to the branches, and then finally at the very end, if there's sclerotherapy that's needed, then that sclerotherapy can be done.
Another question, how much are the fillers?
Well, it's hard to discuss pricing on a live event because we don't know what you need. It depends, like Laura said many times, we have to assess what you need. Each syringe has a certain cost. I think one of the biggest problems we run into is when the patient comes, well, I can only afford 1 filler, 1 syringe, but I want you to make my face look great. And it's like, it's not going to happen. This is not going to happen. So most patients need an average, what, 3 to 4 syringes?
3 to 4 syringes. They say usually it's about 1 syringe per decade. It's a good rule of thumb.
Yeah, that's the best answer we can give. That's a difficult one to answer on a you know.
Another question, does doctor perform fillers as well?
I do perform fillers. Like I said earlier, I have worked with many nurse injectors who I've trained. The problem happens with availability. So Laura is available, 5 days a week, doing nothing but injecting. I'm getting that. My July is pretty tied up. I mean, we're getting to the point that I'm operating 4 days a week, and we're doing, like we were saying earlier, 6, 8-hour surgeries. So I can't be in the middle of surgery and then break out to do a little filler, because the whole filler takes its own time. So for the most part, Laura does the fillers. And I would, for example, when I was between nurse injectors, I was doing a little bit more fillers, but then Mary Jane took over doing fillers. But Mary Jane, she likes her anesthesia better. So then we finally got a full-time nurse injector. So it's not that I don't like doing fillers, it's not that I can't do fillers, it's just that I need to be in the OR, because that's something that only I can do.
And so, what is the difference between varicose veins and spider veins?
That's a good question. So the question is, what's the difference between varicose veins and spider veins? So spider veins are really small, and they can be usually treated just with a little injection, and that's what they call sclerotherapy. The problem is, if that little spider vein, again, the little leaf at the end of the branch, is being fed by a thicker, larger vein that you can see is like a bluish color, that's more of a varicose vein, and especially if it's bulging. So if you try to inject the sclerotherapy to the spider vein that's being fed by this bulging varicose vein, you're wasting your time and money. Because what you need to do is get rid of that varicose vein, and that's done with a procedure called a micro-stab phlebectomy, where we numb the area after we've marked the vein, and then gently tease out that varicose vein. And if you do that, well, then that little spider vein will usually just disappear. But if you have underlying reflux, which is venous insufficiency, which is what we do the ultrasounds for, then you can't do the phlebectomy because you haven't fixed the reflux. And you still have that back pressure, and so that's the difference. It depends on how they're treated.
Right.
And I think that the question would be, what are the consequences of not getting treated for varicose veins?
Okay, follow-up question regarding varicose. That's a very good question. So like I said earlier, one of the worst problems with varicose vein disease is when the skin in the ankle breaks down and they get what's called a venous stasis ulcer. And that's a real problem. It's expensive for the insurance companies. They can create infection for the patients. It can be dangerous. And that's end-stage varicose vein disease. Another end-stage varicose vein disease is where they get so big that they rupture and you just have spontaneous bleeding. And patients freak out when that happens. And they'll go to the ER. And they don't have to do that. If you have a spontaneous rupture, all you have to do is elevate your leg and just put one finger and stop the bleeding. And give it about 20 minutes, it'll stop bleeding. Then wrap it and then come see us the next day. Don't waste your time going to the ER for a spontaneously ruptured varicose vein. The other problem that a lot of people don't realize is there's actually a medicine now on the market to treat restless leg syndrome. Well, restless leg syndrome is from varicose vein disease most of the time. So if they come in and I fix their reflux or their venous insufficiency, a lot of them come back and say, oh my God, my restless leg syndrome is so much better. The heaviness in their legs, the achiness in their legs at the end of the day, how ugly the varicose veins look. So you start going from serious medical problems to pain, which is also a problem, because if these varicose veins clot and thrombose, it's extremely painful for the patient. And we have to put them on blood thinners for like 3 months, and then they come back and we can do their definitive treatments. So there are medical consequences to not getting your varicose veins treated, and that's actually the reason why most insurance companies still treat most varicose vein disease. They put in a lot of hurdles to get the treatment covered, like compression stockings and things like that, but at the end of the day, they get the treatments that they needed. All right. So what we're being told is that our hour's almost up. Not by so fast, right?
Fast.
Not as bad as you thought it was going to be.
No.
So again, we are RGV Cosmetic Surgery and Vein Care. I am Dr. Filiberto Rodriguez. This is Ms. Laura Navarro, our nurse injector. And there's probably going to be a lot more questions. This happened last time. Please don't hesitate. We do have actually someone responding in real time to our Facebook page. And if there's any questions she can't answer, she'll get a hold of me and we'll get you the best answer. What was the thing you wanted me to look at, the Facebook inbox?
Oh, yeah. They can send messages to our
They can
Facebook.
send messages to our Facebook inbox, so that works well too. Our phone number, most people don't want to write down a phone number. It is available on our website. Our website is www.rgvcosmetic.com. The phone number is 956-622-5707. That's 622-5707. Anything else that we needed to add that we haven't discussed, Laura? Again, one thing I mentioned at the very, very beginning, that I'll reiterate again, due to COVID and the office size in Brownsville, we have had to close the Brownsville location temporarily, and it's probably going to be closed for a while. And we have a lot of vein patients from our Brownsville clinic, and I strongly encourage you, don't delay and don't put off getting the vein treatments that you need. I know it's a drive, but come see us here. We'll do everything for you here. It's for your safety. It's for the safety of my staff that we're not seeing patients in that office. That office is just not COVID friendly. It's very hard to social distance in that office. Whereas this office, social distancing is almost automatic. So for all of our viewers from Cameron County, you know, Laura, of course, does all our injections here. People drive to see me all the time. In fact, I just operated on a woman from Del Rio and from San Marcos. You know, I have people driving to see me from all over Texas for cosmetic surgery. So I know it's an inconvenient drive from Brownsville to here for the veins, but it's important, and we're here to take care of you. So, okay. Yeah. Okay, so we have about 8 more minutes, and this one last question came up. What is the difference between Vaser liposuction and body tight? Well, the difference between Vaser liposuction and body tight is that all body tight includes Vaser liposuction. So I discussed earlier with the fact that Vaser liposuction is a big improvement over traditional liposuction without Vaser. In my hands, I don't like to do liposuction without Vaser. I will add on body tight when, for example, I have a lot of women who come to me, and I'm going to use as a model, and they say, I don't like this loose skin, and I don't like this loose skin, and it's not enough to warrant a cut, but I also know it's too much looseness for Vaser liposuction alone, so that's where we discuss adding on the body tight. The body tight's very slow. It can take an hour to add on body tight to the arms, because you slowly superheat the skin to tighten it. And the best analogy I give patients is that Christmas basket with the wine bottles and the fruit that people give, and the way they tighten the plastic on the cellophane on it, they use the hair dryer, and that heat is what tightens the plastic.
The heat wrap.
The heat wrap, and that's what we're basically doing to your skin with body tight. But before we do the body tight, we have to do Vaser so that the body tight can go smoothly. After we finish with the body tight, then we have to suck out all the melted fat so we don't cause any burns. So it's not, don't think of it in terms of either body tight or Vaser. I have both technologies. So any patient who's going to do body tight with me is going to get Vaser, just kind of for free. There are other practitioners who only have body tight, so that's it. That's all you get. And then I have a lot of patients who don't need body tight. They only need Vaser liposuction. So I hope that answers the question. Just think of body tight as an add-on for areas that really want or need extra skin tightening. Is the best way to think about it. So how are we doing?
We have time for another question. What I think is good, we kind of talked about this in the meeting, but what kinds of booty augmentations do you have?
Question was, what kinds of booty augmentations do we have? There's really 3 types of booty augmentations. The most popular, especially down here, is fat transfer. The only thing with fat transfer is you really have to have enough fat to do it. If you're a skinny mini who's coming in who wants a bigger butt, the only option is a butt implant. I do really good gluteal implant surgery, but as I stated earlier in the program, gluteal implant surgery, patients have to realize it's very serious. It's not just like getting your breasts done, and you have to be committed to self-quarantining for like 4 to 5 weeks so that you don't break open the incision from the gluteal implants. Now, if I have patients who've lost a lot of weight and they need a body lift to lift up their butt, well, they can put implants through that incision, and that incision heals great. So we've discussed so far for booty augmentation is mainly fat transfer, and when I do fat transfer, I do use platelet-rich plasma to make the fat stick more. Gluteal implants, and then my least favorite is the Radius Sculptra that you hear about, that people are saying that's how Kylie Jenner got her butt, and she went to Vegas and some guys injected her with a lot of Sculptra, which is a type of dermal fillers, but you're talking tens of thousands of dollars of Sculptra to do that. And the results are inconsistent because we can't control what the Sculptra does. So that option exists out there in the world, injections for butt implant, for butt augmentation, but I personally down here, it's not feasible. I think down here it's either fat transfer or gluteal implants, with or without a body lift if needed.
One question, will you continue to offer virtual consultations once the state is fully open?
Again, with the virtual consults, we actually have been very pleased. I have been very pleased with how the virtual consults have been working. Like I stated earlier in the program, virtual consults really are not great for breast consults. Any kind of breast consults. The virtual consults just don't allow us to really help the patient pick the appropriate implant for them. But otherwise, all the other procedures are perfectly amenable to virtual consultation, and we've kind of now basically just integrated into our practice as part of the practice. So if patients feel more comfortable doing the consult virtually and then deciding to book for surgery before coming in physically into our office, that certainly is appropriate. And if we are consulting and they want to add on their breasts, well, then we simply say, well, why don't we finish this in person next week? Why don't we make an appointment with Rose? So the short answer to that question is yes, we will continue to offer virtual consultation. No. They say we only have 4 minutes left, so they want me to kind of reclose it. We can answer a quick question real fast if there's something, but if there's no burning questions, then again, I want to thank you all for watching us. Again, I'm Dr. Rodriguez, this is Ms. Laura, our nurse injector. We are RGV Cosmetic Surgery and Vein Care. And just to remind everyone, yes, we do excellent breast and body cosmetic surgery. I have to do a lot of redo breast and body cosmetic surgery. We do excellent med spa, dermal filler injections, Botox injections, laser treatments, and we have the most comprehensive varicose vein clinic in the country. And that's true, and that's coming from Edinburgh, Texas. And you may or may not believe it, but if you were to go to the national meetings, you definitely see what we're talking about. And one thing I do like to tell all people is people love to follow people on social media, and I think that's fantastic. But what a lot of people forget to do is actually go to their websites and look at real before and after pictures, and that's going to basically separate the cream from the rest. And that's something that a lot of people forget to do. And then just one last thing, and I'll just say this in closing because we're almost out of time. A lot of people ask, well, what's the difference between board certified plastic or board certified cosmetic, and who? Again, go to their website, look at the before and after pictures, and then you pick who you think is going to be the best for you. And during the consult, you want to establish a relationship with that surgeon, because if something goes wrong and if there is a complication, you want to make sure that you get along and that you trust the whole team, the enormous team of support that's going to be caring for you. And that's all part of the consultation process. All right.
Alrighty.
Oh, great.
Fun.
No, that went awesome. I think that was fun.